Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us today. In studio today, we have Susan Dost, President and CEO of SheridanCare In Home Healthcare. She's here today to talk with us about her business and how she's helping our senior citizens live productive lives in their homes for as long as they can. How are you doing this afternoon, Susan?
I'm just great. Thank you very much for having me.
Thank you so much for granting us some of your time. You are the President and CEO of SheridanCare. You are an in-home healthcare company. What prompted you to get into home health care?
Oh, that's a great question. I started the company 14 years ago, and I really saw a need to be a little different than everyone else in the greater LA area through witnessing caregivers for my grandmother. Her name was Helen. She was a Sheridan. So I grew up in Michigan on Sheridan Road, and the family has owned that plot of land for 158 years. So it was a meaningful name to me. She was a meaningful person to me, and she really helped hone who I am today. She was an extraordinary woman. So I saw caregivers with her, and I thought, wow, this is an amazing business. And my mother actually said, well, I think it's something you could do in LA. So went back to LA and just started to learn about it. I found a mentor. I just developed a different methodology than other companies in LA based on service, and that's how I started the company, just one client at a time.
Now, do you deal with seniors exclusively, or is it anyone that requires assistance in their home health-wise?
We're mostly serving our esteemed citizens of greater LA. Occasionally we help someone who is a little bit younger, but that's pretty much our niche.
Are all of your staff members registered nurses, or do you have nurse assistants, or is anyone who desires to give care to someone a candidate for employment with Sheridan?
Yeah, anyone who has their heart in the right place and is a compassionate caregiver, that's who we hire, and that's who we match up with our seniors in LA. We hire certified nursing assistants, we hire companion aides, we hire home health aides. Just caregivers is really the level we're at. Nursing is another notch up. If you want an LVN or an RN, that's another company that's a sister company of ours called Nurse at Your Door. That's just someone who's a little more skilled. We have nurses who do visits.
Now, once you hire someone, obviously they may have their heart set on giving care to esteemed citizens, or they may be someone who, as you say, is a little bit more skilled. No matter their level of training or skill, do you still train them in the way that Sheridan provides care?
Yes, training is mandatory here at this company. So if they've come to us with some credential, a CNA, they have taken time to learn their craft, but we really insist that they're trained here at this company. We have ongoing training. We have a trainer come in once a month who is, gathers the folks together, and we have Alzheimer's and dementia training. We have other disease-specific training that's really mandatory. Ongoing training is crucial to us, even right down to etiquette training, where we have caregivers go through just some very commonsensical things in terms of, helping a person in and out of a vehicle, down the stairs. So just to be more knowledgeable also sets us apart from other companies in LA.
Now, do you have a division, or is everyone who's employed with Sheridan, are they ever called on to simply give companionship and not a whole lot more, just to sit and talk and be a companion for a certain amount of time?
Sure. Yeah, joyful companionship is key to living a long, happy, healthy life. So caregivers, as I said, if they're compassionate and they are doing this for the reason of feeling good about what they do every day, what gets them out of bed in the morning, what makes them happy about going about their day, then they're joyfully giving companionship, which is largely, what helps a person age in place more gracefully.
You mentioned the greater Los Angeles area. That's where you're based, and that is an extremely large area to cover. Having been in existence for a while, do you cover outside the LA area, or do you have any satellite facilities further out?
We don't right now. We're considering it, but after 14 years, we've put ourselves in the middle of LA, so we're geographically accessible to our clients all the way from the South Bay, Palos Verdes, all the way up through Calabasas, back if you will, sort of a triangle back towards downtown and Glendale area, and then back again toward, more toward the airport and into the South Bay.
And that keeps you extremely busy, I'm sure.
Well, we're busy, but we have a great administration here who is an extension of me, and we have 160 caregivers out there today helping people.
When it comes to the sweeping changes in healthcare here in the United States, how does that affect you as the caregiver and the person that is going to receive care? Say, as far as who is going to pay, is there Medicaid involved? Are there insurance problems that you fix for these folks, or are we pretty much on our own when it comes to dealing with the healthcare system?
Yeah, that's the real hiccup in all of this. Is the climate is really changing, and there will be disruption to this industry as a result of all the new regulations, especially in the state of California. If you want me to get into the new regulations, I can do that. There's overtime and sleep time, and what I think you're referring to is the Affordable Care Act. That absolutely adds to the cost of our services now, and that just gets rolled on to the consumer. Sadly, that's someone who has saved money their whole life, wants to age in place, wants to retire in their home, but now they're hit with these rising costs of a caregiver who now has to have Affordable Care Act. They have to have insurance. They have to have overtime. They get paid while they sleep if they live in. There's all new regulations. But going back to your question about the method of payment, it's either long-term care insurance or private pay. There is a veterans program called Aid in Attendance, and that's if you're a surviving spouse of a veteran, or if you are a veteran yourself, you're entitled to some benefits based on your income. But long-term care insurance, if you've had the foresight to go out and buy a policy, that pays for what we do. Otherwise, it's private pay.
So we're talking about the time that a caregiver spends with the client as well as the services that they provide? Or is it just based on how long you're at the residence?
It's based on how long the caregiver arrives. When the caregiver arrives, they start, they clock in, if you will.
Okay, so as long as they're there, they're on the clock. But if they have to, say, give a bath or maybe an injection or some type of therapy or anything like that, or even feeding someone, that's not an additional cost, right?
No, we're on an hourly flat rate. The caregivers, they don't do any sort of injections. The nurse at your door, the other company we do, the more skilled nursing visits, they do that. But caregivers aren't allowed to do any sort of injection.
You mentioned Alzheimer's and dementia care earlier in our conversation. Many times there are people that suffer from dementia, Alzheimer's. They have more difficulty during the nighttime hours than in the day. Do you provide, say, emergency or quick care to a client? Say you've left for the day and they're having distress at night and they would like you to come back. Is that something that you provide as well?
That's a great question. And yes, we're open 24 hours a day, 7 days a week. So Alzheimer's and dementia people are afflicted with sundowners. So exactly what you're mentioning. They get a little agitated at night. And we have night shifts. So we have awake and alert shifts at night, which are usually a 12-hour shift from 7 to 7 or 8 to 8. And that gives the family peace of mind. Probably if you've had children, you've had a night nanny, so to take care so that you could get rest. So same sort of concept.
How can clients get started with SheridanCare?
Thank you so much for asking. We are available 24 hours a day, 7 days a week. If a family wants to get started, we would come over, one of our care managers, come over to the house, provide a no-cost assessment. That's where we sit down with a family, get to know their routine, what's important to them, what they might need help with. Really listen to them in terms of what they expect of a caregiver and match them up perfectly based on skill set and personality.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. We've been in studio today talking with Susan Dost, President and CEO of SheridanCare In Home Healthcare, based in Los Angeles, California in the United States. And it's been great talking with you today, Susan.
Thank you very much, Neil.
Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.